Hi, good morning everyone. Today I'll let you know a few MCQ from past RRB staff notes paper. Here you can see the first question. Formula for calculating the crude death rate. Formula for the calculating the crude death rate, and the answer is number of death during the year divided by mid-year population into 1000. So actually this CDR indicates the number of death per 1000 and mid-year population. And if you have any problem to remember this formula, just you remember this hint. My 1000 is equal to CDR, mid-year population into 100 is equal to crude death rate. Okay, the next question you can see, what is pulse deficit? The difference between the apical pulse and radial pulse is called the pulse deficit. The difference between apical pulse and radial pulse is called the pulse deficit. Here you can see actually apical pulse we can assess to the stethoscope, radial pulse we can assess to the palpating, and the position of this radial pulse is wrist and the position of apical pulse is left side of chest. Next question you can see, anything that evoke a response in the organism called, and the answer is stimulus. And this stimulus also divided into two types, external stimulus and internal stimulus. External stimulus is nothing but if a stimulus comes from the environment, that we can call the external stimulus, like temperature, predators, presence of water or food. Internal stimulus is nothing but if the stimulus comes from within the organism, so that we can call the internal stimulus. Example, germs, dehydration and lack of energy or pain. And the third question, challenging of a strong and socially unacceptable drive or urge into form that is acceptable to a society is called as, and the answer is sublimation. Sublimation is nothing but it is one of the defense mechanism, and here you can see the person changes his unacceptable behavior or impulses to acceptable behavior. So that type of behavior we can call that sublimation. The person changes his unacceptable behavior in the society into acceptable behavior in society. So that we can call the sublimation. And here you can see example, the patient actually he has the anger but he can't show outside. So he can't show on everyone. So that's why by he relieving his anger by hitting a punching bag. So this is sublimation. Here the person showing his unacceptable anger into acceptable one by hitting a punching bag. Okay, next question. What is the normal length of the neonate body? The answer is 50 centimeters. Okay, and here some parameters also there. The normal respiration rate is 30 to 60 breaths per minute, and apical pulse 120 to 160 beats per minute. Temperature 97.8 to 99 degree Fahrenheit. Axillary temperature 97.5 to 99 degree Fahrenheit. And not only that, heavier neonate tend to have high body temperature. Then next, weight of newborn 2005, normal weight of newborn 2500 grams to 400 grams, and length 500 centimeter. Okay, the next question, the proportion of clinical cases resulting in severe clinical manifestation known as, and the answer is virulence. So here the simple meaning I tell you. So virulence is nothing but damage, okay, is a degree of damage caused by microorganism to the host is called the virulence. If a microorganism shows heavy symptoms after severe damage, so that process we can call the virulence. Okay, so that they ask the question here, you can see the proportion of clinical cases resulting in severe clinical manifestation. Okay, because of that microorganism damage, it shows severe clinical manifestation. This process is called the virulence. Not only that, so this also you can see what is infectivity and what is pathogenicity, difference between. Okay, just you see difference between virulence, infectivity and pathogenicity. Infectivity is nothing but capacity of virus to enter the host. Okay, capacity of virus enters into the host, so that is called infected. Nothing but how much infection is there inside the body, so that we can call the infectivity. And pathogenicity is nothing but ability of organism to cause the disease, so that we can call the pathogenicity. And next question you can see, nurse patient ratio for the teaching hospital. Nurse patient ratio for the teaching hospital, the answer is 1:3. And next one, what is the plasma protein that constitutes about 40 to 60% of total plasma protein? Nothing but here in our body 40 to 60% which protein is present, and the answer is albumin. And some important points about this albumin. So albumin we can call the most abundant circulating protein, and it constitutes about 40 to 60% in our body, and we can also call it is a globular protein, and it is also maintain the osmotic pressure of the body. And not only that, it also transports the various ions, acids and hormones, and the weight of this albumin is 66,000 D. And the functions of albumin is it acts as a transport for various ions or molecules, and it is also like free fatty acids, calcium, and certain steroid hormones, and bilirubin and copper. Okay, next question you can see, the congenital absence of parasympathetic ganglionic nerve cells of the colon and the rectum is. So here congenital by birth. If the newborn doesn't have this parasympathetic ganglionic nerve cells in the colon, so that condition we can call Hirschsprung's disease. Okay, and here you can see it is also, we can also call the aganglionic megacolon or congenital intestinal gangliosis, or we can also call congenital megacolon. And so the common clinical manifestations you can see, the newborn who has this disease, swollen belly and green or brown substance, and substance vomiting and delayed passage of meconium. And next question, what is choanal atresia? What is choanal atresia? And here you can see this is also one of the congenital obstruction of nasopharynx called choanal atresia. And the types also you can see here, two types, unilateral choanal atresia, bilateral choanal atresia. If one side of nose is blocked, so that we can call unilateral choanal atresia. Both sides of nose is blocked in newborn, so that we can call bilateral choanal atresia. The next question, the primary granuloma formed in the tuberculosis known as. The primary granuloma formed in the tuberculosis is known as. Here you have the options, Ghon's focus, caseous focus, globate cells or red cells, and the answer is Ghon's focus. Actually this is one of the primary lesions of lung caused by Mycobacterium tuberculosis, and it is developed in the non-human host, and this name is given by the scientist Anton Ghon. Okay. Next question, which vitamin converts prothrombin to thrombin? And the answer is vitamin K. Vitamin K, the chemical name of vitamin K is phylloquinine, and the function of this vitamin K is help for the blood clotting. And not only that, RBC also called erythrocyte, leukocyte, thrombocytes. The answer is erythrocytes. And so WBC we can call chemical term for WBC leukocytes, and platelet thrombocytes. Average span of blood platelets are, and the options are 7 days, 9 days, 11 days and 18 days. The answer is 7 days. Then the lifespan of RBC is 120 days. Okay, here you can see some important vitamins and their chemical name. So vitamin A, chemical name is retinol, and the deficiency of vitamin A causes night blindness. B1, thiamine, deficiency causes beriberi. B2, riboflavin, deficiency causes cracking in the skin. B7, biotin, paralysis. And C, chemical name ascorbic acid, deficiency causes scurvy. D, calciferol, deficiency causes rickets. K, phylloquinine, deficiency causes blood clotting delay. Okay, then Here you can see the mechanism of blood clotting also. Here they asked question, right? Here they asked, so based on this question I written this one. Mechanism of blood clotting so occur by 3 steps here. So when the blood vessel damages, it releases the calcium ions and it releases also thromboplastin, and these two, with the help of these two, prothrombin converted into thrombin, and this thrombin converts fibrinogen to fibrin. Finally, so what is this fibrin? Fibrin is the function of this fibrin forms a network of fiber and that traps platelets and blood cells, and last you can see blood clotting or blood platelet plug formation. Then umbilical cord contains options: 2 arteries 1 vein, 2 arteries and 1 vein, and 1 artery and 2 veins, 1 artery and 1 vein. And the answer is 2 arteries 1 vein. Okay, just remember this diagram, and by seeing this diagram you can recall your answer. Okay, then or just you remember this end 0 2 1, 2 arteries 1 vein. Then similar to pulmonary artery and pulmonary vein, the umbilical artery carries deoxygenated blood and umbilical vein carries oxygenated blood. The next question: metal produces ringing sound. They are said to be. The answer, here you can see the options: ductile, malleable, lustrous, sonorous, and the answer is sonorous. Hint, just you remember this: sono sound, or both start with SS. Okay, then next question: the stage of embryo in which all the body parts are identified called as. The stage of embryo in which all body parts are identified called as. Here options: fetus, zygote, egg, gamete, and the answer is fetus. Okay, the next question: the process by which muscular fibers of the cervix are pulled upward and merged with the fibers of the lower uterine segment is known as. The answer, options you can see: effacement, sign of placenta suppression, receptive of relaxation, none of above. Here they asked question based on cervix. Okay, so when the cervix pulled down and merges with the fibers of the lower uterine segment of uterus, and that process we can call the answer effacement. Effacement is nothing but thinning of cervix about labor to start or labor to complete, so that we can call the effacement. Okay, this you can see. Actually, this is the head of the baby, head of the fetus, and this is the diameter of cervix. Okay, so when baby coming down, the diameter of cervix decreases. So that process we can call effacement. So thinning of cervix before the labor, about the labor complete, so that we can call the effacement. Okay, next question: what is the bath used to remove the irritation of certain types of skin diseases and provide soothing effect called? Which type of bath we can use to relieve the skin reactions of skin disease, and that type of bath called hot bath, siege bath, mud bath, or bran bath? The answer is bran bath. Bran bath is also called a colloid bath, and so it is also called medicated bath, and used to treat the skin rashes or itching. And this is one of the ancient process. And what are the agents they are using in this bran bath? Gelatin, starch, bran, or added. Okay, the next one, here you can see siege bath. Siege bath is nothing but immerse of hip and buttocks to relieve the discomfort, pain, muscle relaxation. So that bath is called siege bath. And temperature used for this bath is 95 degree Fahrenheit, and we can increase up to 104 to 110 to Okay, 104 to 110 degree Fahrenheit. Okay, the next question, which muscle injury causes torticollis during delivery? Which muscle injury causes torticollis during delivery? Skeletal muscle, sternocleidomastoid muscle, cardiac muscle, smooth muscle. And the answer is this one. Okay, sternocleidomastoid muscle. Actually, what is this torticollis? Torticollis is nothing but it is one of the symptom, and we can characterize it by turning or backing of the neck. Turning or backing, not burning, backing of neck during delivery. We can see in newborn because of, is there any damage in the sternocleidomastoid muscle in the newborn? The next one, milk ejection hormone. Milk ejection hormone is oxytocin, growth hormone, follicular stimulating hormone, and the answer is oxytocin. Not only that, oxytocin also called the birth hormone, and the function of this oxytocin is plays an important role in parturition, the process of giving birth, and it is secreted by neurohypophysis, nothing but posterior pituitary gland. Actually, this oxytocin synthesized in the hypothalamus and it stores in the neurohypophysis. Oxytocin is also called birth hormone, and not only that, it is also stimulate the vigorous contraction of uterus. Next, neuroleptic drugs also called. Neuroleptic drugs is also called antidepressants, antipsychotics, antiepileptics, or hypnotics. Okay, and the answer is antipsychotics. Not only that, this neuroleptic drugs is also called major tranquilizers. It is also called antipsychotics or major tranquilizers or neuroleptics, and actually it was discovered in the 1950. And some important points you can see. First generation antipsychotics we can call typical antipsychotics. It was discovered in 1950s. Second generation we can call atypical antipsychotics. Were discovered in 1960s but introduced in 1970s. Next question. How long do you need to wait to decipher the tuberculosis test result? Options: 38 to 62 hours, 48 to 72 hours, 28 to 52 hours, or 58 to 82 hours. The answer is 48 to 72 hours. Okay, so actually this test we can also call skin test or a Montague's test, purified protein derivative. And here the dose of this tuberculin test is they insert 5 tuberculin units intradermally, and after 48 to 72 hours we should check for the result. And here you can see the diameter of erythema formation. After 48 to 72 hours, if erythema 5 or more millimeters, then it is positive in HIV patient. Nothing but HIV patient has the tuberculosis. If its erythema is 10 mm or more, then it is a indication that the person abusing drugs. If it is 15 or more, then the erythema, the diameter of erythema is 15 mm or more, then so this is an indication that no known risk for TB. Okay, the full form of BCG here, Bacillus clement-guerin. Next question you can see, which technique is used for separating colloid particles from small ions using a cellophane or colloidal? And the answer is dialysis. Okay, so dialysis actually first introduced in the 1861 by British chemist Thomas Graham. Okay, then which proteins are classified based on their functions? Here you have the options: globular proteins, fibrous protein, protective proteins, simple proteins. And the answer is protective proteins. Protective proteins classified based on their function. Then some important points also you can see. Protective proteins we can call the glycoproteins, and deficiency of these protective proteins causes the metabolic storage disorder. The function of these protective proteins is it act it acts as a defense mechanism, and not only that, it is produced in spleen, lymphatic cells in response to foreign substances. Main function of hypoglossal nerve is the option vision or sensation, sensational hearing, swallowing and speech. The answer is swallowing and speech. Okay, actually this hypoglossal, some important points you can say. Hypoglossal nerve we can also call the 12th cranial nerve, and it helps for the speaking and swallowing, and not only that, it moves the substances around the mouth. Then the process of selecting a subset of population for survey called sampling, random allocation, triangulation elements. The answer is sampling. Sampling is nothing but is the process of selecting a small number of elements or population from a large population or group of elements. Okay, so at last here you can see whatever the points up to now we have discussed. So 12th cranial nerve, hypoglossal nerve, and the function of this hypoglossal nerve is it is used for the swallowing and speech. The lifespan of platelet is 7 days. What is a sample? Sample is nothing but selecting subset of population from the large population. Protective protein classified based on their function. And what is the dialysis? Dialysis is nothing but separating the colloid particles from small ends using the cell film. Then after tuberculin skin test, we have to wait up to 48 to 72 hours. And neuroleptic drugs we can also call antipsychotics or major tranquilizers. And milk ejection or birth hormone, oxytocin. Damage to the sternocleidomastoid muscle in the newborn causes torticollis during delivery. Then bran bath used to treat the skin rashes, and we can also call colloid bath. Effacement is nothing but thinning of cervix before labor. Sonorous is nothing but sound producing metals we can call sonorous. Then umbilical cord contains 2 arteries and 1 vein. 2 arteries and 1 vein. Okay, 2 arteries and 1 vein. Okay, then zygote is nothing but the stage of embryo where all the parts we can identify. Vitamin K converts prothrombin to thrombin. And not only that, Gonfogos is nothing but primary granuloma formed in tuberculosis. And Hirschsprung's disease, nothing but absence of parasympathetic ganglionic nerve cells in the colon, we can call this disease. Then albumin, most of the protein present in our body, about 40 to 60% is albumin. And virulence is nothing but the process of disease producing severe clinical manifestation because of virus, so that we can call the virulence. The next one, 1:3 is the nurse patient ratio for teaching hospital. The next one, the length of neonate 50 centimeters. Sublimation is nothing but if the person transforming is unacceptable social behavior to acceptable social behavior, so that we can call the sublimation. The stimulus is nothing but is a response, the activation of response in the organism, that we can call the stimulus. Pulse deficit is nothing but difference between the apical pulse and radial pulse, that we can call the pulse deficit. Crude birth rate, the formula for crude birth rate is number of death during year divided by mid-year population into 1000. Okay, and I said one hint also, my 1000 is equal to C crude death rate. Okay, not birth rate, crude death rate. So this hint you can remember. The next one, lifespan of RBC 120 days, apical pulse the normal apical pulse rate in newborn is 120 by 160 beats per minute, and the weight of newborn is 2500 to 4000 grams. Thank you.